And just a little note that there are a couple of images of human remains, but they are not from the present-day Pathology Museum at St George's. They're actually just historic pictures where the eagle-eyed amongst you will see human remains, but not very distinct. So a little bit about the Pathology Museum. We're located in southwest London, in Tooting, and the Pathology Museum is a collection of about 2,000 human remains, so organs and tissues with lots of different diseases. And it's a really active and busy teaching area, and that's the majority of my job is teaching across all of the different healthcare courses. St George's was previously just healthcare, so we do paramedics, biomedical science, medicine, and so on. So all of those come in and they get teaching using the collection, and it's a active learning, and it's a really, really great resource for our students. But what I'm going to be talking about here today is going to be the new development that we've had in the museum more recently, where we've actually been doing researching the patient stories. So really looking particularly at the historic collection in order to understand more about the people whose human remains were collected over the last 200 years. And then I'm going to be linking that into a community engagement project that we've been doing in order to understand how you can share these patient stories with the public, with the ultimate aim being to introduce this collection to a new public audience in the future. So the Pathology Museum, it's got 2,000 examples of human diseases, and many of these are disturbing in terms of what the patients had to endure because it's before the time of anesthetics and so on. And also almost always fatal, but often they were collected after post-mortem. This in particular is a picture from the section room at St George's whenever it was located at Hyde Park Corner in central London. And you can see a rather sinister-looking Henry Grey in the foreground, just next to the cadaver's foot, just in the middle. And he was one of the curators, past curators of the Pathology Museum. And it was, so we've got about 800 that were collected at post-mortem over the last couple of hundred years that we can document as being added to the collection. And what we wanted to do was really have a look and find out more about some of these, because if you look at this example, this is the cataloguing record for probably one of the most remarkable specimens or preparations or human remains. The terminology here is often kind of like difficult, that we have. It's a liver, and I'm not showing a picture of it today, but it's a cirrhosis of the liver, and it's about this size in width, about this size in height. It's about probably 4 to 5 times the size of a normal liver, and it's from a man who was aged 43. And so the cataloguing record is relatively vague. It just tells you that he drank lots of alcohol and that he was, in terms of like his weight, he was very much greater weight than sort of like average. He was 27 stone. And so in terms of actually understanding that patient's experience of being at St George's and what happened, we really didn't have very much to go on. But we did have a post-mortem reference from 1883. And one of the really great things that we've been able to do at St George's to actually add to the story is to go to these post-mortem records. And in a Wellcome-funded project, they were all conserved and digitized, and they're put online, and they're freely available for members of the public or researchers to access and search. And this is actually the post-mortem report that you can see in front of you from this particular patient. And it's usually a 2-pager, and so on the side on your left, it's the actual post-mortem itself, so it's really detailing what happened in terms of like what organs were examined, what weight they were, and so on, what the clinical features that they found. And then on the other side, it gives you more of an insight into what happened to the patient at admission. And I'm just going to zoom in here. And so first of all, it gives you an insight into what happened in terms of the patient's life before they were admitted to hospital, really quite detailed in some cases. So we know for this particular person, and here the handwriting again is a skill that you need to learn, and the archivist at St George's is very good at it whenever I get stuck. And he spent years in the army, and then he was a gentleman's servant, and then for the last 7 years of his life, he was a coffee house proprietor. Still trying to figure out which coffee house in London that might have been. And it also gives you an idea about what types of questions the doctors asked of their patients whenever they were admitted to St. George's. So he was asked about his weight, so it tells us how much alcohol he was drinking. Also asked whether or not he had syphilis, and which was often, and what types of symptoms he was having. So he had morning vomiting and so on, so he was feeling very unwell. And it also tells you about what types of treatments and what happened to the patient whenever they were actually admitted to the wards. Because he was 27 stone, he wasn't actually fit and well enough to walk upstairs to the men's ward, and he had to be accommodated on the ground floor of the hospital. There wasn't really much treatment. He had advanced liver failure, and he ended up dying within 36 hours, and the only treatment he really had was to remove the fluid that had built up in his abdominal cavity. We do know that this person also probably had an iron storage disease, but of course that's a hereditary disease, and it wasn't actually known about at the time. So from this you can really piece together quite a lot, and actually you come to a point in your research into this particular person where you have to wonder where you stop, because of course you have the name, you have the cause of death, we have census records that are linked to this, and so it's a really interesting conversation to be had there about how far down you go, especially whenever you have ancestry online and DNA databases and family trees online, because of course you can have direct descendants that are still alive from this particular person. And what I would say as well is that you can see here, this is just a little excerpt from the left-hand side of the post-mortem report, and you'll see in red it says PrEP 9-1X, and that means that is an indication that that was retained in the museum. So that's the code that we know. That's why there were 800 that were collected during post-mortem at St. George's. Not all of them exist still in the museum today. Many of them have been lost. But a lot of the work that I'm trying to do myself in amongst my teaching responsibilities is to really understand and trying to link those together. Sometimes, of course, we don't have any labels left on the pots. That can be quite frustrating. Sometimes there's a little bit of luck. So as you can see, sometimes there's wonderful drawings within the post-mortem reports. And in one particular case, there was a drawing of a skull, which was completely identical because it was quite unique in the way it looked and the operation that had been done on it. And so we were able to actually link that to a post-mortem report. Sometimes we have to go back to the newspapers and other historical records, but it's a slow process, but one that's really rewarding whenever you're actually able to give more details and more context to that person's journey within their time at St. George's. So the next step really was to think about, you have these patient stories and you understand more about them, but what do you do with that information? If you are inviting the public into your space, how do you explain these and what is meaningful for the members of our local community when they visit us? So I would say that I'm not all open to the public at St. George's. It's only a very small part of the collection that's over 100 years old that is able to be viewed because of our human tissue license. But what we were able to do was open up that subsection of the museum, and with thanks to funding from the Association of Independent Museums and the Heritage Fund, we were able to do a one-year community engagement project. And this was really the first time that we'd opened up the space, and it was a lot of learning on all sides. This was done in collaboration with my colleague in the archives, so we were able to draw on the heritage that's held within the archives and all of the historical records and medical equipment and so on that's in the archives, in order to really broaden the themes that we were able to explore in this project. Also key for this project was that we had external partners. So we had a meet and make in Tooting Marketplace. They are a couple of artists who are really embedded in the local community, and they really were able to introduce us to lots of community groups so that we could actually be really looking and talking to the people who live locally for us, and that was really important. And it was a community-led project, so we really wanted to know what they wanted to see whenever they came to the museum. What were they interested in? And we found that there were very broad themes that they really found that were of interest. So, for example, in the panels you can see on the left-hand side was the language used to describe the patients in the historical record. If we go back to the example of cirrhosis that I've shown you, the admitting doctor referred to him as an enormously fat man. And of course, that's really great as a teaching point for the medical students whenever they come in terms of our communications. But also for members of the public coming in, they're really quite shocked by the language that was used, particularly for patients in terms of the learning disabilities and so on, and how that was referred to in the historical record. And they were able to reflect on that and actually recorded as part of an output for this project in terms of the an online exhibition, their reflections upon that. Others had creative responses, so because it was led by creative artists, and in these co-creation workshops, so there was a lot of creativity involved, and in some cases there was a lot of examples of tuberculosis in the collection, so that was something that was explored with drawings of tuberculosis, as you can see on the bottom left here. Others wanted to do independent research. For example, they did journaling, so you can see that in the bottom panel in the middle. And so they were journaling all of the different infectious diseases that they encountered during their exploration of the museum and archives. And other ones were more interested in the place, so where the museum was situated in terms of place. This is us poring over a map in Tooting Marketplace, because the museum itself has the collections of other lost hospitals within that local area that were closed, and we've taken on their pathology collections as well. So really quite a lot of reflections in lots of different ways that we really never would have foreseen. So it was really rewarding, and as I said, we've got an online exhibition that was actually narrated with narrations by members of the participants and so on. So really something that has really helped us to move forward and to have gained momentum from this and some lasting changes, such that we are thankful to the Royal College of Pathologists for additional funding to run behind-the-scenes student-led museum tours. And so those were another co-creation type of exercise where the students went into the museum and they decided what they wanted to do and how they wanted to run tours, and other ones that were run as part of teaching, so really drawing this out and actually having this as part of the teaching, and which is really great, because then we can actually have the students coming in, and as part of their formal teaching they're still able to do these types of things, so it gives them a great experience, and it also really helps me out because it's because I'm really just a staff of one part-time, so it's really great to be able to do that. And you can see here on the left-hand side, these are some bullet points here, which is the feedback from those behind-the-scenes tours. So you can really, I think that we've managed to hit the right tone, personal and compassionate, really maintaining the dignity of the patients whose human remains are in the museum, and that was something that I was really, really strongly felt was important for everything that we do, and I hope that that's something that we've achieved. And this is something that's pausing at the moment while we do major conservation on the collection, but this is something we really want to keep going for the future. So finally, I'd just like to acknowledge all of the people who've worked with me on this. So Ulia is the archivist, the head of the archives at City St George's, and absolutely wonderful internal partner for me to work with. And Jenny and Gemma from Meet and Make, wonderful creative artists who were amazing, learned such a lot from working with them. And Michael Schilling, who was a filmmaker who did the film to document that community, the Deadly Diseases Project, with us. And thank you to all of our funders for all of the support they've given us. Thank you very much.